They're coming. Sooner or later, people will have to pay the price. Either they come now or they come later. Good. The title of this talk is an overview on sanitation systems and the aspects of functionality related to health protection. Basically, there are two texts here that I'm referring to. The left side is the Compendium of Sanitation Systems and Technologies. It's a so-called AWAG, E-A-W-A-G compendium. It's something that came out of a collaboration with SuSanA, with the Sustainable Sanitation Alliance in Switzerland, with a lot of authors around the world. The other one is the so-called Health Compendium, which came out of my own institute, the Stockholm Environment Institute. These together provide the community that works within sanitation a good, solid overview of what there is out there, how it functions, and how it can protect health, what the risks are. So this is new stuff, and I think it's really changing the landscape on professionalism within the sector. Now, the other thing is the rather breakthrough guidelines that came out in 2006, which we were very much involved with, and it will take probably about 10 years, if you like, to become implemented and put into national plans, because they are guidelines. These, if you like, provide openings for all kinds of innovations. You might hear about some of them. Speak up. Yes. Now, what do we mean by sanitation? It's obviously not just a toilet. It has to do with collection, storage, treatment, disposal, reuse, recycling, all of these steps along the chain. And it has to do with the human excreta component, that's feces and urine. It has to do with sludge, which is a mix of things, sewage effluent, the grey water, that sometimes can be separate, and it even has to do with solid waste. Sanitation is very much related to hygiene and behavior change. And it's very much related to drainage and management of stormwater. So it's actually a multifaceted array of disciplines and sub-disciplines. And we talk about the so-called value chain, the user interface, the collection and storage, and there are many different varieties of how that's done. The conveyance, may it be through a mechanical system or a sewer system, or even as simple as a jerry can or a tank, to the treatment step, which can be a semi-centralized or on-site type of thing. Anything from a reactor to a composting system or a wet lab. And then finally the reuse and disposal. Any one of those, if they are not functioning, will cause dysfunctionality in the entire system, somewhere along the line, somewhere. And so it's naive to think that if we just talk toilets, that's enough. So there's an interest in seeing that the value chain is actually developed and maintained and paid for. When it comes to hygiene, we talk about exposure and transmission routes, and that thereby causing risk. So we're talking about ingestion of excreta through hand and dermal contact, via flies and mosquitoes, inhalation of particles and aerosols. Even eggs can be inhaled from roundworm, for example. Contaminated groundwater, contact with overflowing leaky contents, ingestion of excreta itself, and then consumption of contaminated produce like vegetables. So these are the many, if you like, different vectors that can cause discomfort and disease, morbidity, and mortality. And if you just look at very quickly at the relative amounts of, if you like, diarrheal disease, the one that comes out on top, of course, is in sub-Saharan Africa, and that's on a per capita basis in terms of disability-adjusted life years. And we talk about 1.2 billion cases leading to 770,000 mortalities, mostly kids under 5 years in the sub-Saharan African region. Looking at things like ascaris, it's roundworm. You see the concentration in Africa and also in Asia, some parts of South America. So there is, if you like, a need to look at these and why these parasites are actually occurring. This particular parasite was taken from a 3-year-old intestine. 3-year-olds. From what I know, this is from the South Africa Medical Research Council. The patient that actually did not die. It was actually removed from the. This is an extreme case of actual intestinal blockage by ascaris. But this kind of thing is something that we can actually sort of make comments about at this conference, and it has to do with a lot of things: institutions, financing, attitudes. And this, if you like, is the most advanced form of open defecation. That's the dumping of sludge. So we have to actually see the whole chain right through to the end to provide safety and security. And this sort of practice, of course, is occurring. The innovative side in an ideal village setting is to actually understand the nutrient loop. And here we have a diagram of a dry toilet with some urine diversion. After drying, then it's packaged as fertilizer. It goes down to the bottom, and it's actually being used to fertilize crops, and then it's consumed again. That is an ideal cycle, which can actually be implemented and is being implemented in many parts of the world. But when it comes to urban systems, things break down, and this is where the sensitivities are, and the disease practices. The spreading of disease in peri-urban areas, what have you. What we don't think about is that sanitation can be actually part of a food chain. There's all sorts of things to win in providing, if you like, value to the products. So something called productive sanitation that's taking off in Niger at the present time is becoming a national program after a couple of years of testing. So we're looking at humans as being part of, if you like, a nutrient pump. And so these things are definitely not wasted if they're put back into agriculture and back into soil. It's a different attitude. Here we have a picture in Agui province of a urine diverting, urine collector. And this is actually in a village area and rather popular amongst children as well as adults, and easy to use. Reduction of evaporation by using these methods, and the stuff is then stored before it's used again on vegetables. Here's the so-called storage and hygiene step, and in fact in the local language it's called takin ruva, and so it isn't urine anymore, it's actually called yellow fertilizer. And here we are applying these in a very hygienic fashion with 2 seedlings, and then there's been a major response on this. The poorest country of the world is growing now on smallholder farms vegetables for villagers, and this has now become a national program. Now, if there's anybody here from Niger, they will be able to provide that experience to you. We have been working with IFAD as well as the national government in Agui province. And you can see some of the growth here as well. They're fantastic. The comparison of onions, for example, that's a good one with urine against the control. So it doesn't stop there. We're also looking at other innovative things in this, if you like, chain, the value chain. We're looking at what can be done in schools. So some of the work we're doing in Zimbabwe, actually training students to build, using traditional materials, these composting type shallow pit toilets. toilets. These are pit latrines that are designed to be emptied, not to be filled. So they obviously fill up, but they're easy to empty. They're shallow, and they compost because they're not so deep. They have soil in them. Here's another one with the diversion of urine in a dry type of vault, and then the burial of the dry material for further composting. And then it can actually be used to plant things. The message I have to you is that this whole debate about sanitation is really a question of functional steps. And if you look at the first 4 steps that you see, the lower 4 steps, they're health functions. That's the containment of excreta, having access to, excreta containment being the first and most important function. The next one is actually access to that toilet 24 hours a day. The third one is doing something with water, so you don't get, if you like, mosquitoes and things like that, of flies. The fourth one has to do with finally the pathogen elimination, to get that stuff actually out of so it's no longer. So these are the 4 steps up, and then if you want to take it even further, you can get into environmental functions like nutrient reuse in agriculture, nutrient containment, so it doesn't get out into the environment, and then the final one is the more exotic integrated resource management, the portioning up of stormwater and wastes and sludge and grey water and solid waste. So those are the functions that can provide innovation and new ways of thinking. And some of it has to do with, providing value to something that we just call waste before. So the debate, I think, is just starting, actually, new ways of looking at sanitation. Finally, and I think this is the final slide here, it's kind of a concluding slide, that safe sanitation can be made possible if you take a systems approach, the so-called value chain, all those steps that I was talking about. The thing that is, it has to be made affordable, it has to be made functional, it can be maintained, it has to be appropriate for the targeted population, and it has to be participative. Then the entire chain needs to be designed around what you're going to do with it at the end, so we don't have the dumping of pathogens into the environment. So disposal and reuse has to be a part of the design. And finally, there's all kinds of profits. Not only does sanitation pay for itself through the health protection, but there's also other things like energy savings. We don't have to cut as much wood for fuel. We can save on water, and we can also produce some of the foodstuffs that are required. So there's very much to bring into this discussion about the value chain. And this talk, if you like, has been brought to you by a partner of the Sustainable Sanitation Alliance, and you're very welcome to see the booth downstairs where there's some publications, the ones that I've referred to, and you're very welcome to learn more about that alliance, as well as the other partners within the alliance, so we can do this thing together. Thank you.
Thank you very much, Arno, for this very clear introductory presentation. And I wanted to also let you know that these publications that you referred to at the beginning, there's some hard copies at that booth next door that you can pick up. And so we are filming this session with our cameraman over there, and afterwards it will be available on the SuSanA website. So if you enjoy any of these presentations so much that you want to share it with colleagues back home, you can later on just click on the link and you can view it on the video. So we have time for 1 or 2 short questions before we move on